Do you have tiny white or skin colored bumps on your face that no matter what you do to get rid of them, they just don't squeeze out? You might be dealing with something called milia. Today, I'm going to give you an overview of what they look like, steps you can take to avoid them, and treatment options. I'm Dr. Hannah Kopelman. I'm here to help you maintain healthy, beautiful, and flawless skin. If you're new to my channel, don't forget to hit that subscribe button. First, let's talk about what milia look like. So, like I mentioned, they look like something you just want to squeeze out, kind of like a whitehead. Milia are super tiny. They're only about 1 to 4 millimeters in size. They're usually white. They can be skin colored or even yellow in color. And they usually appear on the face, sometimes around the eyelids, around the cheeks, even around the lip area. But you can also see them on other parts of the body. So, what in the world are these milia? Well, they're actually dead skin cells, which we call keratin. Keratin is the protein that makes up our skin, and they're trapped beneath the surface of the skin. And it kind of forms what we call like a cyst. So it looks like a little bump with white material on it that you just want to get rid of so badly because they're just annoying to look at. But don't worry, they're not painful and they're not harmful. Milia are super common. Now, we don't really understand why some people are more prone to it than others, to developing them, but we do know that there's a component that is genetic. So it can run in families, and you might notice that your parents have them and you also have them, or your siblings have them, and that's the genetic component of milia. So believe it or not, milia can start anywhere from when you're newborn, right out of the womb, to all the way to when you're an older adult. So we do know that there are several factors that can contribute to the formation of milia. First being sun exposure, excessive sun exposure. We know that too much time in that UV rays can cause sun damage and can lead to milia. In addition, we also know that smokers have a higher propensity to develop milia as well. Now, one of the biggest factors of forming milia is the use of heavy, pore clogging moisturizers or makeup. So, in another video, I'm going to go over makeup options that are good for your skin. But one thing to try to avoid milia is try to avoid anything that will be heavy and clog those pores. So, anything like petrolatum, like Vaseline, Aquaphor, shea butter, lanolin products. Try to really be cautious of what you're putting on your skin and use non-comedogenic products because you don't want to get any clogging of those pores, which will lead to milia. We do also know that if you don't exfoliate very often, then you're likely to develop milia, or it's very possible. I mean, there might be people who don't exfoliate at all and they're really lucky and they never develop milia, but it is possible that if you're not someone who exfoliates quite often, that you will be more likely to develop them. In addition, I do want to mention that milia can form around burns or scrapes from the trauma or from excessive rubbing or itching an area, that it's very possible to form milia in those areas as well. Prolonged steroid use on your face can also contribute to milia, as well as there are some medical conditions where you can be more prone to milia, which we won't get into today. Before we move on, I do want to mention that milia can resemble other things. Most commonly, it can look like comedonal acne. It can also look like calcinosis cutis, syringomas, which are sebaceous hyperplasia, and sometimes it can even resemble a skin cancer. So you have to be careful that what you are treating is milia. So as I mentioned when we first started this video, there are some people, unfortunately, who are more prone to developing milia, and you can't really help it, mostly due to genetics. But there are steps you can take in your skincare routine that can try to reduce the amount of milia you form or just kind of help exfoliate that skin. So we're going to go through what those steps are. So first things first is be gentle, and there's just a few steps. Try to pick products that are lightweight, not heavy, non-clog forming. So this is also known as non-comedogenic. So when you buy makeup or moisturizers, you'll see that usually printed on the label. You also obviously want to try to be very careful in the sun because that's a factor that can contribute to the formation of milia. And one way to help when you're going out in the sun is use sunscreen that is non-comedogenic. And I'm going to share what my sunscreens are in another video that I really recommend for your face. Now, something really important, probably the most important thing I'm going to say in this entire video, so just listen up really closely, is I don't recommend trying to remove milia at home. They're really difficult to get out, and it requires a dermatologist to extract them in the office. And I'm going to go through that with you, what that is. But what you can do at home is take these steps and use products that are gentle and exfoliate. And like I said, use these lightweight non-comedogenic products, and that's one way you can prevent forming more milia. Don't go get your sewing needle and try to do an at-home surgery. You'll cause a bad scar and you can even cause a bacterial infection. So that's just a big no-no, and please, please don't do that. So some milia can resolve on their own, and especially for children or infants, those will go away with time. So just leave them alone. They'll be okay and they'll resolve. But let's go through products that I recommend that you can use at home that can either help get rid of them or help exfoliate your skin really gently. One of the best products that you can buy over the counter is a retinoid, which is a vitamin A derivative. So I don't recommend using this in pregnancy or if you're breastfeeding. But what the vitamin A retinoid does is it increases cell turnover of your skin. So it prevents those dead skin cells from getting trapped underneath the skin cell surface. And again, this helps exfoliate your skin and prevents those milia from forming. The key to retinoids, which I'm going to go into in a later video, is you must be consistent with them and you can't expect them to work overnight. It's not like a magical pill where you take it once and you see the results the next day. It actually takes like minimum of 6 months to make a difference, a true difference on your skin, and be consistent with the product. The retinoid option that you can buy over the counter, and it's very affordable, is called Differin, which is also known as adapalene. And this is actually the highest strength of retinoid that you can buy over the counter without a prescription. However, if you do see your dermatologist, they can give you a prescription for a stronger retinoid, which is usually called a tretinoin, and it does exactly the same thing. In addition to retinoids, there are other options, including salicylic acid, alpha hydroxy acid, and beta hydroxy acid. All of these will gently exfoliate your skin and increase cell turnover. I want to talk to you about some products that I've tried that I think you'll really like. First is the Revision skincare line. They make a purifying cleansing gel. This is great for gently exfoliating the skin. In addition, I really like the Murad AHA BHA cleanser as well as the Skin Medica AHA BHA cleanser, and these will be shared below. Now, I recommend doing a little trial and error with these products I recommend. But if you do have those milia that are really stubborn and they just won't go away with any product you try, which is very common, or you're someone who has a lot of milia, like I have seen someone with like over 50 million just on their face. Don't be alarmed. Yes, that's normal. That's just someone who's more prone to making them. Then she is someone that I recommend coming into the office for the in office procedure. And it's really safe, it's very quick and effective. So, what they do in the office is they use a sterile instrument or sterile needle and they make a little opening in that milia, and then they're able to extract the contents of the milia and they go away. If you're someone that has several milia, then usually we have to use what's called an electric needle, also known as electrodesiccation, and actually burn off or kind of like melt those milia away. Both procedures are very safe and they're really not that painful, even though they kind of sound painful, because usually we use some numbing ointment and numb up your face before performing the procedure. But this is definitely the best and safest option because you'll avoid scarring and you'll also avoid the potential for infection. I do want to mention that there are some milia that will resolve spontaneously on their own. They don't require any products or treatments, but those can take several weeks to years. If you're someone who just can't stand watching or looking at your milia anymore, they're not permanent and you can get rid of them. I hope I summed up for you today what milia are, steps to take in your skincare routine on ways to modify what you're doing and ways to prevent them from forming, and of course, the treatment options. Have you ever had milia? What works for you? I want to hear, I want to know. Share them in the comments below. And don't forget to give this video a thumbs up and subscribe to my channel. See you in the next video.